Hello everyone, it is Artemis. Today we will be speaking about the different types of dissociative disorders that are currently within the DSM-5. The first we shall speak about is Unspecified Dissociative Disorder, or UDD. This diagnosis is given in clinical settings wherein there is not enough information to diagnose a patient with a more accurate diagnosis, in situations where the clinician does not wish to specify, or in situations in which the client's or patient's symptoms do not align with any particular dissociative disorder, but are still dissociative in nature. Next, we shall discuss Other Specified Dissociative Disorder, or OSDD. There are several subtypes of OSDD, but we shall be discussing OSDD-1. In OSDD-1, you have two subtypes, OSDD-1A and OSDD-1B. In OSDD-1A, one will have a system, much like in DID, or Dissociative Identity Disorder. But the members of this system will be less distinct and unable to take control of the body, though they will influence thoughts, feelings, and actions. In OSDD-1B, everyone will be quite distinct and able to take control, but there will be no amnesia. Next, we shall discuss Dissociative Amnesia, or Dissociative Fugue. In dissociative amnesia, an individual is unable to recall information that would otherwise be stored in memory, information that they should normally have access to. This can be quite troubling, and as with all dissociative disorders, it involves distress, as that is a key characteristic of being diagnosed with any disorder. Dissociative fugue is a loss of memory of the self, in which a person is no longer able to recall information about who they are, and thus may act counter to their usual behavior. Next, we have Depersonalization and Derealization Disorder. The two can be seen in conjunction or can be seen separately. In Derealization Disorder, an individual loses touch with their groundedness in reality. They are unable to distinguish that what is occurring is real. Everything to them feels false. They have a sense of numbness, a distorted sense of time. Things no longer appear to be happening in reality. In Depersonalization Disorder, an individual no longer feels that what is happening is occurring to them. Also, they will have that sensation of numbness or different perceptions of body sensation or distortion of time, but their perception of what is happening will be perceived as though it is happening to someone else. These two can also work in conjunction, in which an individual may have both experiences, that things are neither real nor are they happening to them. Then we have Dissociative Identity Disorder, or DID, which we've of course talked about extensively on this channel, in which an individual has lack of memory due to amnesia of events that cannot be explained by normal forgetfulness, so in which a system is present of more than one identity, which has control over the body at various different times. And this cannot be related to spiritual practices, the use of substances, and whatnot. And of course, with dissociative identity disorder, there is always the presence of trauma, as with all dissociative disorders. Dissociative disorders are caused by trauma. A traumatic event occurs, and the brain is unable to process this information in a way that would integrate it into memory properly. And thus, a dissociative disorder is born, as the person attempts to cope with this seemingly unsurvivable trauma. In these traumatic events, a person copes by dissociating. The severity of the event, for the individual person experiencing it, of course, the duration of the event, whether or not these events reoccur, and the individual person's particular forms of coping with dissociation will decide which type of disorder they develop. Overall, there are a multitude of dissociative symptoms that can be seen within dissociative disorders and within other psychiatric conditions. But within the scope of dissociative disorders, distress and a cause of trauma is what is linking all of the various disorders together under one umbrella. I hope all of you found this educational, and that all of you have found this information useful. I shall speak to you again in the future. Goodbye, everyone.